Bulumlaka Fiji, and welcome to Gold FM Speak Your Mind. And this afternoon, we touch on a subject that we've been highlighting through the course of the various shows here on Gold FM, and that's the 16 days of activism against gender violence. Now, we've been saying that this not only is a initiative that has been driven over the most years by NGOs and CSOs, but also has been recognized and has also this year been a campaign that has been talked about a lot, and you perhaps have heard quite a bit. Orange You Hood by the United Nations and various international agencies and regional bodies in the Pacific also. And one body that has been very active with this, and we've mentioned this already too, we are right here on Gold FM, is the European Union office here in the Pacific. And we're glad to welcome onto the show the Deputy Head of Delegation, Mr. Johnny Engel Hansen. Welcome to the show, sir.
Thank you very much.
And, first of all, let me just ask, are you wearing orange today?
Yes.
Is that a little bit of orange?
It is, yes. It's an indication of the support that I personally and the European Union delegation is displaying for this 16 days of activism.
Now, we've also heard that the European Union has also taken this on, not only here in the Pacific, but in various offices across the world. And part of it is also just not only highlighting Orange, but you've also taken on initiatives in terms of, we'll touch on what you take on in the office through the 16 days. But let's talk about also the issues that, in terms of partnerships with various bodies, let's say, for instance, in the Pacific. How have you taken on the issue of ending violence against women?
Well, first of all, would I say that gender equality and violence against women is an issue that is very close to the heart of the European Union. It's a policy area that is very dear to us. And when there is this 16 days of activism initiated by the United Nations, the European Union felt that it was something that we should support and support strongly. So we have been having a campaign going all these 16 days. We're now in the 15 days, ending tomorrow. And this is, of course, just these 16 days. There have been ongoing programs for years where the European Union have supported civil society organizations and non-governmental organizations in the Pacific on issues related to gender, on issues related to eliminating violence against women.
Now, how much work or how difficult has it been for the EU in terms of trying to partner up with civil society organizations and having the understanding of your policies integrated into programs?
We have a very good cooperation with a number of civil society organizations and NGOs in Fiji, in the Pacific. And it's quite easy for us. We have good response, and I hope that these organizations feel that they have good response from the European Union in addressing these very difficult, complex issues. We've been working with NGOs, we've been working with governments, we've been working with other international organizations, and I think we have a very good response and a very good cooperation among ourselves and with each other.
What about here in Fiji? There are particular groups, civil society organizations that you actively associate yourselves with in terms of support to the work that they do. Could you be able to just highlight a few?
Sure. We are currently supporting a number of initiatives that contribute to improving the situation of women. To mention a few, as you ask, we support Live and Learn to help mobilize women on governance matters, human rights, democratization processes. Another one is FemLink, where we ensure that mass media and the public, they are aware of women human security issues, and to ensure that more political space is available for women to engage actively in development of your country. We assist Women's Action of Change to help marginalized women and young people to integrate better into society via various programs. We support the Visay Health Center. This is a center that strengthens the rights of women by providing them with knowledge, access and control of their reproductive health. Excuse me. The aim is really to empower rural girls and women by raising awareness of reproductive health and at the same time providing them with the relevant targeted health care. There is also Homes of Hope, which is a single mother initiative where we support the income generation for single mothers and thus empower and enable them to have a livelihood. That's just some of them. And if I may, I would just also like to mention an initiative outside of Fiji. In Solomon Islands, there's a very exciting thing going on right now, where the European Union and United Kingdom jointly fund a theatre group, Stages of Change. You may have heard of it.
Yes. Yes.
It's a vehicle for reducing violence against women and increasing women's participation in civil society and peacemaking in Solomon Islands. This Stages of Change has been very successful in cutting across language, gender and age barriers and bringing up an open, honest discussion on the subject of violence against women. It helps engage the general public in the subject, as it has traditionally been taboo in certain communities, particularly in the rural areas of Solomon Islands. This is just Solomon Islands. I'm sure the same thing would apply to many other countries in the world.
I'm sure. Now, with these programs, how realistic are we at, or what stages with the programs that you support, at ending domestic violence and ending violence against women? How do you feel that are we looking? How much of an impact do you hope also for these programs to make?
I think we can all agree that this is work in progress, that ending is perhaps a target which is distant in the future, but we know the way there. I mean, reducing and keep on reducing by addressing this issue. And I'm confident that by doing things like we do right now, talking about it openly, we are contributing to reducing violence against women.
Now, we're two males who are here talking about ending gender violence. Do you feel that over the years that this perception of having male advocates as advocates against gender violence, do you feel that there needs to be a lot more work from our male counterparts?
Yeah, you're probably right. I mean, as men, we have work to do. We have work to do by being role models, showing other men how to behave and how not to behave against women, just as women are role models for other women and girls. I mean, we are all role models in one way or another. If we are public figures, we are role models to a general public, but we are also role models as parents. Mm-hmm. I mean, I have children, and the children have fathers and mothers and fathers. If the son watches the father beat the mother, he will see and learn. If the girl watches her mother getting beaten, she will see the mother's reaction. And so if parents, they behave in a certain manner, it will be picked up by the children. And thereby, let's say, if the father shows the son that there are different ways of handling arguments and disagreements and do it differently, and if the mother says no and also shows her daughters that this is not acceptable, sure, daughters will learn.
Right. Well, hopefully we'll have a change in behavior here in the Pacific after all. Well, on that note, we'll take a short break here on Gold FM Speak Your Mind. We'll be right back on Speak Your Mind. Oh, we're speaking of, the 16 days to end gender violence here in the Pacific. Welcome back to Gold FM Speak Your Mind. We continue our discussion here on 16 days to end 16 days of activism to end gender violence. And here in Fiji, we have many programs of which we have spoken of. But today, I'm speaking with the Deputy Head of Delegation of the European Union in the Pacific, Mr. Johnny Hansen. And Mr. Hansen, now, how involved is the EU with the program for 16 days to end gender violence, and what types of programs have you had?
We are very much involved on these 16 days, and we have taken a deliberate decision on promoting this, in particular on our social media platforms. Mm-hmm. If you have been following
I
our
have
Facebook,
been.
you will have seen that there has been a very, very active campaign ongoing every day,
Yes.
addressing the various subjects that are important in this particular respect. And we have had a very good response. We have seen our messages being picked up and shared quite widely across the region and outside. And of course, this is not just the EU delegation in the Pacific. This is a campaign that is ongoing all over the world.
That's right. And now the various days, also of the 16 days, are filled with various activities. Today being the International Day to End, Anti-Corruption Day. And tomorrow culminates the 16 days with the World Human Rights Day. And here in Fiji, we have various marches being organized, but in the capital city, it's being organized here from the bus stand to Sukuna Park. But let's talk about the involvement and the support that you have towards civil society groups. Is it only with civil society organizations, or do you also assist with other programs for government?
We are in discussion both with governments and with NGO civil society organizations. I think ending violence against women is it's a non-political, it's a non-controversial issue. So there is a broad support across the whole political specters. I recall having seen both the government, the prime minister, and government officials, government ministers, and opposition figures speaking out, speaking up. And I think there is really a united front that this is an issue that needs to be addressed and should be so.
How do you feel the response here in the Pacific and in Fiji in terms of the stakeholders involved? Are they doing enough in terms of creating more awareness and providing the necessary support that the civil society organizations and those concerned need?
Enough is a very difficult thing to quantify. There's always more work to be done, but I think that a lot of NGOs who are doing this on a voluntary basis are putting in a lot of efforts and are really doing the maximum they can, given the support and the funding that is available to them. You can always argue that we should provide more support, we should provide more funding, the government should provide more, and I think it's probably true that more could be done and more should be done. Perhaps and hopefully this campaign is part of the awareness-raising campaign that would provide more support and more funding. But I also just like to say that perhaps funding is not the only thing. It's a change in attitude, it's a change of behavior, and of course those funding can bring a lot of awareness and spread the message. There's more to it than just funding. It's a mentality that needs to change.
You've been with us in the Pacific for a little while now. How do you feel, just from your understanding, how are we in the Pacific in terms of behavioral change? Do you feel that we still have a little bit more in terms of gender violence to work on? Or are we about on par with the rest of the world?
I don't really think that I am in a position to express an opinion about how you are as a people. When looking into this matter, I actually looked at the statistics of the European Union member states also, violence against women. And I was quite distressed to learn that we are talking about the Pacific right now. Yeah. But when I look at the statistics from the European Union, it's quite scary. There is a wide discrepancy in the figures that we see, somewhere between 20 or 15 to 35% of women have suffered some kind of violence from their partner. I have had some discussions about female colleagues in the delegation about how come this discrepancy, because they are should be quite on the same par, the European Union countries. And we actually think that it is more or less the same. It's just a question of the attitude to it, whether you report it or not. When you are asked, have you been subject to violence, whether you answer truly and honestly and not. This to me shows that the stigma that is it's there. Domestic violence, something you tend not to talk about. What goes on in between the four walls of the home remains in the four walls. It is something that is happening here in the Pacific, and it is also happening in the European Union.
Now, how difficult does that make your work with supporting, I mean, in terms of allowing for more awareness, does it make it a little bit more difficult for institutions like the European Union here in the Pacific to give more support towards?
Yes, it does, because it means that before a problem can be addressed, it has to be brought out in the open. You need to have a discussion. You need to have an awareness. You need people to speak up and bring a problem out in the open before it can be addressed. If you look at the different statistics, I've seen various kind of statistics for the Pacifics ranging from 50 to 70% of women who have been subject to some kind of violence from their partners, whereas only 2%, I think, of them reported to the police. Now, how come this difference? It is something that you talk about in private, but you don't talk about it in the public. And I think bringing it out, bring it in the open, bring it into the public, it's one step towards addressing the problem.
On that note, we'll take another short break here on Gold FM Speak Your Mind. Welcome back to Gold FM Speak Your Mind, and we continue with 16 days of activism against gender violence, and we also continue our discussion with the deputy head of the delegation of the European Union here in the Pacific, Mr. Johnny Hansen. Now, just before the break, we also spoke a little bit about the challenges that the EU and the Pacific face in terms of trying to support programs. Now, what do you hope from the work that you've continued in the area of gender violence? What is there to carry on from here for the Pacific, the European Union in the Pacific?
The hope is definitely to see a reduction in violence, and the ultimate goal is the elimination of all kind of violence against women and girls. That is the long-term objective. That is the long-term hope. Initially, at this stage, as I said earlier, we are hoping to raise awareness. We are hoping to contribute to changing the mentality and the way people respond, the victims and of violence and those who commit violence. I think those who are violent against women, men who are violent against women, they need to change their behavior. They need to understand that it's actually not it's not a big man who hits a woman. It's a little man who will hit a woman. And the woman will have to learn to say no. They will have to stand up for their own rights. I know it's difficult. It's very easy for me to sit here and say so, but they will have to learn to say no and not accept.
Now, we're looking at the various partners that you work with here in Fiji, to be specific, that you've mentioned already. There's a lot of support for women in terms of taking on their issues. There's work with Femlink, ensuring mass media and public awareness is raised with women. Is this is this something that you also would continue to encourage with your partners?
Yes, absolutely. The support that I have outlined earlier is an ongoing, and actually I'm happy here to tell you that actually this Friday we published another call for proposals for NGOs. And it is to assist NGOs in building the capacities and addressing issues affecting, in particular, vulnerable populations, women and young people. This, as I said, just started this Friday. It's in the amount is in the order of 6 million Fijian dollars, so it's quite an important initiative, and it would demonstrate our ongoing commitment. In the next cycle of development cooperation, which will be implemented from 2015 to 2020, there is also issues of good governance and policies and gender issues that will be among the focal sectors that will be addressed there.
Now, how does one get access to this, or is there more information available on your website, perhaps, or?
when there are call for proposals and when there are programs that be implemented, these will always be published. So in the major newspapers and on our website, yes.
All right. Now, for more, with the work tomorrow, there's also the World Human Rights Day tomorrow. Is there a specific activity that the EU Pacific Office will be committing to tomorrow, or will you be joining everyone with the march too?
I think it's a good thing to support local initiatives and national initiatives. So therefore, yes, I will be joining the march tomorrow.
And all in orange, I'm assuming, yes?
I will be in orange, yes.
Well,
and I hope everyone will be.
Well, we will be, definitely. And thank you again for joining us on the show. And we hope to see you more often here.
Thank you very much.
And
Thank you for inviting me.
The Deputy Head of Delegation of the European Union in the Pacific, Mr. Johnny Engel Hansen. And we'll be right back after this short break on Gold FM Speak Your Mind. You're back on Gold FM Speak Your Mind, and we're speaking with Dr. Kostas Serafimidis and also Dr. Efuremi Wangainambete on with regards to breast cancer awareness. And it is the month of October, and for many years now, or in the recent years, has become synonymous with the color pink and marking Pinktober. But the last, I'd say here in Fiji, the past, I'd say 10 years or so, Pinktober wasn't an awareness month as much as it is now. And this has been brought about a lot of awareness from health officials such as yourselves, and also has been taken down, breaking down the information to those who are affected, those in our villages, those at the grassroots levels. Now, Dr. Wangainambete, how much work and how much progress have we done as the Ministry of Health and as with the partners and also as people of Fiji? How have we changed over the past few years?
I think I'd like to answer that from the whole gambit sort of thing, Pedeli, because really the issues with cancer in Pinktober is really this is a societal commitment rather than just the Ministry of Health, and I think that's been one of the excitements is because you've got agencies such as donors and Fiji Cancer Society and other people coming to the fore and say, look, we want to be part of this. And this is so important because unless
Having
society actually has a commitment to raising awareness on cancer and breast cancer and other forms of cancer, then really we are left with the Ministry of Health being able to do this on their own. And I guess the other thing that the Pinktober does that I believe is so important is it also raises awareness on the other cancers.
Yeah, sure.
Yeah, because apart from breast cancer being so important in being the leading cancer for women in our country, you've got to remember that there are many other people who have other cancers. And Kostas, your thoughts on this, and also from Greece where you came from, in terms of awareness?
Yeah. People in my home country are very much aware of breast cancer, and because lately with financial crisis and all these bad things that happened in Greece, there is no official screening program, but people have taken the situation in their hands, and they go, and even if there is no coverage from the government, they pay for their mammogram on an annual or biannual basis, and they go and try to do the screening according to the instructions from the doctors. And I know that maybe this costs some more money for every single individual, but you need to take into account that mammogram is not very much expensive. It's a test that it's rather an affordable test. So this is what happens in Greece. You know very well, Dr. Wanga, from New Zealand. The New Zealand experience is very well-established screening system. So there is a big screening system, and all the women every second year they have a mammogram and they get checked. And this is the key point in the breast cancer management, to catch the cancer, to catch the lesion before this cancer gives any symptoms. Because some years ago, when we were talking about the prognosis of breast cancers, we were talking about 5 years survival. But now, if we check the studies, we're talking about 10 years or 15 years survival. And this has to do with the early diagnosis that is achieved in the advanced countries.
Well, definitely a huge change from how we are also, with the information that's available now, that plays a very important role, and also for people like us here in the media in passing on this type of message. How do you feel that sort of coordination has been progressing?
I think over the years it's been working very well. I've been involved for a few years with, obviously with breast cancer and other cancers and Picotoba, and I've seen the excitement continue to increase every year, and it really it's great because it makes our work a little bit easier, because we are on the receiving end. Really, when patients come to us, with their sickness that needs to be dealt with. Certainly, we are, our hands are tight, and in a country such as ours, resources are limited. But I must say that we've done a great job, and I think we need to put our hands up and continue to go forward. The only other thing that I believe that we really need to work on is the commitment from partners, and I will say partners and commitment from husbands in terms of breast cancer. Commitment from husbands, commitment from family, especially as the men. I think this is not something that's limited only to breast cancer. It's other cancers where women are involved. Usually the men, may not be there to be as supportive as what we have seen in other countries. But certainly with the media beginning to continue to desensitize the population and say, look, this is a disease that is treatable in its early stages, I think, certainly we can achieve more.
Right. On that note, we'll take another short break, but we will come back to it. 3220-906, 3220-907. You can call us up in studio with any questions. We will talk about how partners and support that breast cancer patients and those who are with other cancers, what type of support that they need. We'll talk about all this in our next segment. It's 10 away from 1 o'clock on Gold FM Speak Your Mind. Gold FM Speak Your Mind. This afternoon we're tackling the issue of breast cancer awareness. It is October, and the month of Pinktober as celebrated marked across the world. And we just had a caller. Hopefully the caller do calls back. 3220-906, 3220-907. You can call us right now, or with any questions you can also send them to goldfm@mbc.com.fj. With us in studio, Dr. Kostas Serafimidis and also Dr. Efiremi Wangainambete. We are talking about the types of support that family and also those who are involved with the patients that have with breast cancer or with other types of cancer. What kind of support do they provide?
It is very, very important, especially in the Fiji setting. Yeah, it is very important, as Dr. Wanga said, the support from the family. We very often we face some cases of patients come to the hospital in a very delayed presentation. So they have some lesions on the breast, which lesions are obvious from kilometers away. And the question that some can be raised is, how come this lesion couldn't be noticed earlier and take this patient to...
Why did you let it go?
Exactly. And in this question, I think that the fact of family, husband, and very close family environment is involved, as well as some other traditional treatment. options that are available here in the Fiji setting, like, for example, massage or some
Herbal
other
remedies.
things, herbal remedies, and this kind of treatments. So the first part of this is the family. I think that the family should know that breast cancer and any type of cancer is very dangerous. So we can't leave our relative, our beloved relative, suffering from a very advanced stage of cancer, let home do nothing. And the other thing is that, with all the respect, most of the times this herbal medicine and massage, they both don't have any positive effect on outcome on breast cancer, in any type of cancer. So if there is any suspicion of breast cancer, I would kindly ask, please attend to a medical practitioner, ask for medical advice. And if you see your beloved relative to have a problem with, might be cancer, might be something else, please convince them to go to seek for medical advice or consultation.
Now, Dr. Wanga, what about here in Suva, in Fiji? What type of treatment do we offer? What stages are we at? Are we able to conduct surgery, or as a lot of information that is passed around, there's only overseas attention available?
We are quite fortunate because the government of the day has done a great job with the Ministry of Health. We have in the hospitals, we have, I would say, if I put a number, a rough estimate, I would say a lot of the cancers, we have at least 80% of the treatment available locally. And I'm talking about the medical forms of treatment.
Mm-hmm.
I'm talking about things such as the surgical interventions that are needed. I'm talking about the advent of some of the new drugs that are being tried overseas for other forms of cancer. For example, you'll be surprised to know that we also have them available here. So, we must thank the government and the Ministry of Health for a wonderful job in providing this free for our people. This is free. This is taxpayer funded, and this is free. And that's something that I always drive to the patients when I see them. I say, look, your treatment and your potential of cure, all it needs is your yes and your husband's yes. Because everything else, you don't pay for it. It's completely free. In America, you need health insurance. Many other nations around the world, they need health insurance. We don't. It's all taxpayer funded, and it's all free. And the other thing that, just going back to what Dr. Costas was saying, is we need to support people with cancer. When somebody has a cancer, they've got a growth, they have a lump, and they need treatment. And you think of it like, for example, I would like, sometimes I share to the husbands, I say, look, remember your wife, when she was pregnant with your first baby, she had a lump, she had a growth, but it was a baby. And you were excited. When she finally had a baby, you were excited. You were excited for the baby, excited for the... And then now she's got a cancer, that excitement has faded away. And, our wives, our women, our sisters who have breast cancer, they need that support. They need that excitement around them. I'm not saying being excited in a bad way.
Attentive.
But being attentive, being there for them. Yeah.
Now, do you feel, how are we in Fiji? How are we in terms of progress? Because we can say yes, in the last 10, I'll refer back, in times when my mother passed sadly of cancer, but over the last, I'd say from the last time, our family has a history of cancer. And over this, with my mother's case, the level of attentiveness and the level of concern and also awareness from our family members was a lot more than, I just say, than her older sister who passed 20 years ago. And even at one time was sort of discriminated against. Now, how do you take, you're observing Fiji now, how have we come?
I think we've improved in that area. Can we do more? Yes, we certainly can do a lot more. And the reason is very simple, Pedeli. We don't have the resources of the big countries. where they can send you a counselor, they can send you home help, they can send you a steward, somebody to do this for you. We don't. And so, that's where the rest of the family have to come in and pitch in and help. And simple things, for example, if you're, if somebody in the family's got cancer and they need to come into hospital for consultation, it's sad sometimes that they come alone. They come
Do
alone.
you still see this?
Oh, we still see this. They come alone and ask them, look, where's your husband? They say he's not here. So certainly what's going to happen is we're going to have a discussion, and after that we'll have to have another discussion. So, we can still do more, but we've certainly progressed.
Well, sadly, doctors, we've run out of time on the show. But is there any other last message that you would like to convey to the public?
Yeah, the message is that the take-home message, as we say, is that early diagnosis saves lives. And the other thing is that in this hospital, in CWM hospital, I believe that we can do 90% of, or maybe 95% of the operations to treat breast cancer. So I think that we can actually deal with breast cancer at a very good, decent level.
On that note, thank you very much, doctors, for being on the
Thank you.
show. And that's a wrap here on Gold FM Speak Your Mind. You can send your comments to goldfm@fbc.com.fj. Thank you for joining us this afternoon. You can join us again, same time, same place, right here on Gold FM Speak Your Mind.